this to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office. Experts on what they're talking about.
This is the podcast
for insights into the issues.
China, bioterrorism, Medicare for all. In-depth discussions.
Breaking it down into simple terms. We hold
these truths.
We hold these truths.
With Dan Crenshaw.
The Eagle has landed.
Welcome back, everybody. This is not a surprise to everyone, but I've been very skeptical of universal and indefinite lockdowns. I've been very skeptical of the science behind that. I've been very skeptical of the reasoning used. But let's be honest, there wasn't a lot of reasoning used. There was a lot of fear-based, emotional reasoning used. And I have a feeling that a man named Dr. Scott Atlas agrees with me on that. Scott, thank you so much for being on the show.
Sure, happy to be here.
Can I call you Scott? Should I call you Doctor?
No, absolutely. No, Scott's totally fine.
Okay, but you are a doctor, so I'm going to tell everybody about you for a minute here. So you are a fellow at the Hoover Institution of Stanford University. You're a member of Hoover Institution's Working Group on Healthcare Policy. You've received a BS degree in biology from University of Illinois, and your medical degree from University of Chicago School of Medicine. You've served as a professor of radiology, chief of neuroradiology at Stanford University Medical Center from 98 to 2012. You've done a lot. Let's see, what else? Best-selling books, of course, and one of which I do want to get to, if we have time, is on restoring quality healthcare, a 6-point plan for comprehensive reform at lower cost. That would be nice. So, yeah, thanks so much for being on the show.
Yeah, no, I'm glad to have the opportunity.
So your stuff has been published quite a bit since this whole pandemic started, and because you're a bit going against the grain even from the beginning. I want to get to a lot of the op-eds that you've written and a lot of the good points that you've been making. But when did the spidey senses start to go up on the back of your neck, that you thought maybe there was some groupthink going on here and that maybe we were overstepping in locking people in their homes? And you're in California, correct?
Yes, I am.
And so there was a pretty serious lockdowns in that area, a little bit less so in Texas. We also opened up earlier, but when did you start to question that ongoing narrative?
Well, so the real issue really was simply a matter of common sense rather than anything to do with something that's so difficult to understand. And that is that when you have an infection, especially this sort of upper respiratory infection, you can predict from day one. Every medical student in Texas, I can guarantee it, knows the answer to who would be at highest risk for having a serious complication or dying from a viral upper respiratory infection. Mm-hmm. And that's the same group of people for all of these kinds of things. Generally, it's older people with significant underlying diseases. And so the common sense part number one was, well, let's first spend as much resource as we can and effort protecting the people who are highly likely to be super sick or die. And instead, what was done was not only totally ignoring that, by the way, and not just in the United States, but all over the world, and I can talk about that. Yeah. We ignored the most obvious group to protect, and instead, everyone else was locked down in an unprecedented way. And that means all the healthy people, and no effort really of significance was made to protect the vulnerable people. This just doesn't pass a common sense test. This is not something that's so complicated. I and others said that's what we should be doing. Instead, people were jumping up and down, needing all this kind of testing and stuff. And the reality is that first part, A, protect the vulnerable, B, somehow it was bizarre that we were locking everybody else up. And then the third part is that everyone who thought they were sick, meaning having mild or any symptoms that are referable to this sort of thing, should have assumed they had the virus and self-isolated. That's what we called for. People like me and myself called for protecting the vulnerable, isolating the people who were sick so that they were not going to infect other people. And that's just the step one and step two of what's common sense. So right away, this kind of broad-based societal lockdown made no sense.
It was weird because it just became a narrative. It became like the only option. all of a sudden. And like you said, this was a human race problem. This wasn't like, and I don't like to point fingers here. I mean, I do politically, and I think there's some reasoning for that, but it is a human race problem. The entire human race basically did this, unless you live in Sweden. They seem to be a little bit more common sense than everybody else, maybe a couple other countries too. But you know what my question is there precedent for this? Is there precedent in medical history where it's like, okay, no, you really have to lock the entire society down? Because I'm not so sure there is.
Yeah, not really, because by the time that we were realizing what was happening here, the other thing that came out was, okay, the original sort of massive fatality rate of 3.4% that was predicted, this I didn't mention this, but this was obviously wrong from the beginning, even without any data.
Yeah, like
and that's because
the Diamond Princess cruise. I mean,
and also the denominator, the fraction of people, they were only talking about the people who were so sick that they were going to the hospital.
Right.
And so obviously there were other people that, just like every other viral illness, there was a large number of people who weren't counted in the denominator of the fraction. So the original, knee-jerk reaction of, wow, we got a 3.4% fatality rate here, we better immediately, and the projections of these models, so-called hypothetical really models, were that millions of people in the UK, millions of people in the US were going to die. Okay, you
that's
immediately
scary.
lock down.
Yeah, that's
scary. And that's very scary. And I think it was, everyone accepted that from the get-go, that, okay, we can do a 15-day, you may remember it was 2 weeks basically of a lockdown. We can accept that. We have to stop this and flatten the curve, quote unquote, which had nothing to do, by the way, with decreasing number of cases. It simply meant decreasing the massive theoretical spike that would overwhelm the hospitals by prolonging the cases to spread out and flatten that curve.
Yeah, and that was the original intent, of course, and I've noted over and over again, we moved the goalpost on that and pretended like nobody noticed, but you know what people did notice? And they got out in the streets and they were pissed off about it. And then they were called murderers for being in the streets. And then a few weeks later, then people are out in the streets and they're called, the opposite. And they said, no, well, that's okay. So you've got a real crisis of credibility for some public health experts out there. I think Johns Hopkins, these are credible medical institutions. You've got people from these places saying, no, that kind of protesting's okay, because that's the right thing to do. But that one isn't. I mean, it's just crazy. And then, we need credibility with our experts.
Well, I mean, this is a problem, and this might end up being one of the biggest roadkills of this whole thing. Was that, yes, there are a lot of smart people and they're experts on paper, but from the beginning the models were wrong. And in retrospect, when the computer scientists look at these models, they were grossly wrong and in some cases amateurish, even though they received a lot of attention. But what they did was they instilled fear into public officials. And we have to face it, the overwhelming majority of public officials are medical laymen. In other words, they're naive. They don't have a medical perspective at all. But even experts, doctors and scientists, they really were looking at the numbers and panicking on their own. And this is something that I always have to think about. How could these very smart people use superficial and sloppy thinking, which they continue to do, by the way, and I hope we get to some of that. But, one of the things that I realize is that, okay, what separates a really good doctor from just a smart doctor? And the answer isn't more knowledge, more information that you've memorized in medical school. The answer is being able to take that information, use critical thinking and logic, and decide by sort of deductive reasoning what's going on. And they don't teach logic in medical school.
Yeah, they don't teach it in politics either. Apparently, there's a dearth of politics in a lot of cases. I think, and it's very concerning. I see it constantly, not just with this issue. But my annoyance with especially local leaders and governors and even the CDC was, total inability to think critically. You don't need a medical degree. Okay. You really don't. I saw this stuff coming a mile away. It was, you just need to be able to take in counter arguments and do basic deductive reasoning. And, what do you think about a lot of the studies that show, and there's competing studies on this, and there was a good National Review article that really went through all of them. about how many supposed lives are saved by lockdowns versus plenty of other studies show that there really is no dramatic difference in lockdowns versus how many cases or lives are saved, and maybe it's actually just locking down mass gatherings like concerts and things like that, more protecting senior living homes. Maybe that's what actually has the same effect as universal lockdowns. What do you make of all of those studies? And and some of this is in hindsight, so we can show some grace here to the people we're critiquing. But what do you make of all that?
Yeah. Okay. So this is sort of complicated because there is no real what we call in what rational people in medicine look for, which is a controlled study. Mm-hmm. It's very difficult, but what we can say is there's no clear evidence that a total lockdown benefited from a targeted just doing a targeted protection type of thing with some social distancing. There is no clear evidence on that. And that's obvious. I can go through.
And I would say there's evidence to the contrary. I would say there's evidence that it didn't do it, and that's simply looking in hindsight.
It's more than that really, because I wrote a paper with some colleagues from multiple institutions, and we quantified. It turns out that the lockdown itself is killing people. Mm-hmm. It's not just destroying lives in terms of businesses taking financial destruction to the max. It's literally killing people. We quantified that the lockdown itself, every month of the lockdown, lost as many life years as the COVID-19 pandemic in total has lost in the United States. And so
I'm going to read.
There's that. Go ahead.
I'm going to read what you wrote there on that. I was going to ask you about that because there is a cost to the lockdown that seemed to be basically ignored by everyone. I don't know why. Well, not everyone. People who lost their jobs certainly weren't ignoring it. So you say statistically every $10 million to $24 million lost in U.S. incomes results in one additional death. One portion of this effect is through unemployment, which leads to an average increase in mortality of at least 60%. That translates into 7,200 lives lost per month among the 36 million newly unemployed Americans, over 40% of whom are not expected to regain their jobs. And that doesn't even include all the small business owners near financial collapse, creating lost wealth. That also results in mortality increases of 50%, which is what you write. I mean, this is shocking, but it's also intuitive. People know this. We've seen suicide rates increase. We've seen medical procedures that are not able to get done because hospitals were closed down. I mean, it's ridiculous.
Right. And so what we did, basically, we're very conservative in that article in terms of our calculation. We only included the missed health care. I mean, as many of your listeners are probably aware, 650,000 Americans have cancer undergoing chemo. Half of them didn't come in. Mm-hmm. Okay, 40% of acute stroke patients didn't go to the emergency room for their care out of fear for being infected. 2/3 of cancer screening tests were not done. And ironically, more than half of childhood immunizations were not done, setting up a future healthcare crisis. But what we did was we calculated by actuarial tables and CDC data and studies in the literature. We didn't do anything, no theoretical modeling here. What we did was we took the numbers that were already known, and we only included the missed medical care from those specific instances that I listed in the article, and then the economic change was only from the people who were unemployed. And we took the actuarial data and we got that number, which is basically that the lockdown itself overwhelmingly was worse and continues to be than the COVID-19 direct life years lost.
I mean, it clearly is. And the other thing we have to point out is that when the curve is flattened, the area under the curve doesn't change. It's a virus without a vaccine. So, we were never going to stop the spread of a virus. I mean, maybe New Zealand can because they're an island and they don't have, what I mean? Like I guess it's possible, but it's not possible in a place like the United States. And as soon as New Zealand opens up again to the world, who's to say they won't have another case? I mean, anyway, it's you have to live with some amount of risk. And if we just lost the ability to do that?
Well, I mean, what happened is that there's been a like you sort of said, the change in the goalposts. There's been, I have to ascribe it to fear. that change people's thinking. But there never was, there never can be, and it's irrational to think that you would stop every single case. It's not about the number of cases. It's only about, because here's the reason why it cannot be. We have millions of people with the infection in the United States. It's highly likely that the infection started earlier than anyone has talked about, and this is all over the world. Mm-hmm. But it's more than that. About roughly half the people have no symptoms, and 98+% of people have no serious problem with the infection. So we don't care about stopping all the cases. We cannot stop all the cases. And the only thing that counts is to prevent the people that are going to be super sick or die from getting those infections. We know how to do that. And, there's so many just grossly egregious errors done about policy. The most egregious of all, and the most harmful of all, frankly, is closing the schools. Mm-hmm. I'd love to talk about that, because I think this is something that will go down as an epic failure of judgment in history.
Yeah, well, okay, let's talk about that. I mean, one obvious reason why it doesn't make any sense is because kids are basically immune to the entire thing, so they're pretty much safe. I guess you got to worry about school staff and teachers, but so tell us about the
love to go through this, because obviously there's nothing more precious to anyone than their children, and frankly, there's nothing more precious to the country than the children of the country. And so we have to think very carefully what we're doing, because just like we keep forgetting constantly every day, no one is talking about the harms of the policy. In this case, the harms of closing schools are enormous. And I'm going to go through those harms, and then I'll talk about why we don't need to close the schools. Yeah. Let's go through the harms first. The harms of closing the schools there's data already. Reading levels are dropping. In some neighborhoods, half of kids don't even log on to the schools. This idea that distance education is adequate is a completely wrong statement. Yeah. It's frankly done by what I call not everyone has the paraphernalia of the rich, okay? Not everybody has a bunch of iPads in their house or a bunch of computers, Wi-Fi, in a good home environment, by the way, or educated parents to teach the kids, etc. Mm-hmm. But also we know that children go to school for more than just book learning. They're learning how to socialize. They're learning group activities. They're learning how to be disciplined. All these things are gone if you don't go to school. And the health needs that are assessed in school. Where do you think children figure out that they need glasses, that they need a hearing aid, that they learn how to, visibly do phonics and things like this? All of these things are missing if you don't go. Now, why would I say that you don't need to close schools? That's because we know from the data, 99.98% of deaths are in people over 18. Okay, there's essentially zero risk of death, essentially zero for a child. There's essentially zero risk of a complicated serious illness. We know from a study that was published 2 weeks ago or so in JAMA Pediatrics, 46 pediatric hospitals in North America. And their bottom line conclusion is, quote, it is far more likely to have a serious illness with influenza than with COVID-19 in children. Unquote. I mean, if that was the standard, then we must close all schools from November through April. Okay. Anyone who wants to close the schools, it has nothing to do with the children. And that point must be made loud and clear. In fact, it's harmful to the children. Now, you mentioned, what about the teachers? Okay. K through 12 teaching in the United States is a young person's career. Here's the numbers.
That's true.
Half of all teachers are 41 or under, and 82% are under 55. We know the risk from COVID-19, the fatality rate from COVID-19 for people less than 60 years old is less than or equal to seasonal flu. There is no significant risk to the teacher population, and in those isolated cases of high-risk teachers, they have two options. They can be 6 feet away from the children. They can self-isolate. And if they don't want to, if they're still fearful, they can teach from home. But there's no reason to stop all schools and lock up the children. I mean, for the rare cases of a high-risk staff. Similarly, some people say, well, what about they're going to take the disease home and give it to their elderly grandparents or something? Well, I mean, first of all, we know how to keep our elderly safe by now. If you haven't learned how to socially distance, wash your hands, and keep your grandparents safer, I mean, you haven't been alive over the past 3 months. But even more than that, there's data from all over the world that shows that children only rarely even transmit the disease, even if infected. This is proven. It's not that they cannot transmit, but it's very unusual, even to their own parents. So it's simply completely antithetical to science to close K through 12 schools.
Yeah, and so there's a couple points that are born out of that. You mentioned the death rate and how that's gone down dramatically over time. And I think the recent best guess by CDC, and I think, and you can argue with whatever data they're using, but I think it was like 0.04. I want to say, does that sound familiar?
Well, okay, so their infection fatality rate. You're talking about it's a little bit of a different fatality rate. Their infection fatality rate is in the order of 0.2 something. Okay, in other words, it's similar. It's in the ballpark of flu. It's very high for people who are over 70 or 80, but for everybody else, it's not.
Yeah, and that's the important thing to distinguish is that's the flu is what the flu is. It tends to affect everybody. It seems like I'm sure it affects some people more than others. I don't actually know, but we definitely know that the COVID-19 very much affects older people and people with certain pre-existing conditions. And so even that low death rate, it's not really even accurate for healthy, somewhat young people, is it?
Well, 99.8% of people have some kind of a significant underlying condition, so more than 99%. And then there's the other factor that we didn't even talk about, which is that in some states, 50, 60, in Minnesota, 80% of deaths are in nursing homes.
Yeah.
I mean, if we just would have controlled or would control the nursing home and people entering, instead of what some governors did, which was literally order infected people to go into the nursing homes. I mean, this is really a heinous, really.
Some governors like New York. And,
this is the kind of thing that, we demand accountability. This is a big topic right now, as everyone knows. Okay, the vile killing by the policemen. Okay, there's got to be accountability. Where's the accountability for the governors who, in my non-lawyer way, say at least criminal neglect, but intentionally ordering? I mean, I'll give you an example. In New York, they locked down the state of New York on March 20th. It was 7 full weeks until the governor issued the order to be very sort of lock down the entrance into nursing homes. 7 weeks later, after locking up all the healthy people.
Yeah, I mean, it's a travesty, and we don't have to get into the politics of it, but it's pretty obvious from my perch, and because I'm in politics all the time, why that double standard of accountability exists. And I do want to clarify something. It's not just the state of New York. It's from the West Coast to the Midwest to the East Coast. And it's also all over the world. Even in places like Stockholm, Sweden, 70% of deaths were in nursing homes. Switzerland, 53% of deaths were nursing homes. So there was this gross error of judgment. And I can only guess it was out of just simply fear. But it's that's a sort of a reason, but it's inexcusable. Yeah, it's also strange. I mean, I thought we knew all along that it affected the older population much more, but there was for some reason this temptation by the media to constantly highlight younger people dying, just to instill more fear in young people, and they always use whatever numbers they want, right? And they'll give you an absolute number, but if you actually take that number, you're like, wait a second, that's like less than 1% of the entirety of the whole number, and that matters, right? That perspective matters, and they don't mention, well, did they have underlying conditions? Because that matters too. They love to do this, and I'm not really sure why. I mean, recently what I've been dealing with in Texas is the media just immediately pouncing on governors as long as they have an R by their name, because if they don't, then they don't really care. But, seeing increased cases in Texas, and I think the increased hospitalizations by 36%, But what I point out is, okay, if you just hear that, like 36% increase, that does sound like a lot. In reality, it's under 500 additional hospitalizations out of a state of 30 million people. So it's really not a lot. It's also worth noting that we have thousands and thousands of bed space, ICU bed space capacity here, ventilators. It is Texas after all. We have the Texas Medical Center. We're so far away from being at overcapacity or even close to it that it's laughable. But this is the type of fear that they try to instill, and it's ridiculous.
Well, I mean, I'd like to comment on the two things. One is the children. I agree with you completely. The sensationalistic headlines about these rare instances are really out of context. Every doctor in the world knows that every single infection, no matter how sort of benign the infection is, has these exceptional severe cases. That does nothing to take over the discussion normally, and does not decrease the overwhelming evidence that children have no significant risk from this, period. And that's just factual distortion there. In terms of the increasing cases, this is the newest sort of sensationalistic thing. I've looked at every one of these states now. I've been spending days. I mean, I look at this basically 24/7. And, the reality is that these increasing cases, first of all, we know there's increasing cases if you test more. And first I'm going to talk about cases. We know there's increasing cases if you test more. We know there's increasing cases if you have a contagious disease present and you have more social mingling. Okay, that's okay if you don't have it, because the overall majority of people don't have a problem with the infection. So that's not an issue to me at all. The increasing numbers of hospitalizations, when you really look at the data, it's very interesting. Some of the states, they're just giving the total number of people in the hospital on any day. If you look at the day-to-day number of new admissions, for instance, I'm looking at Arizona just now. That's not true that there's an increase. There's no spike going on there. I don't care what the verbiage is, but furthermore, even in Texas, when you look at this and you say, okay, is this really a spike? Okay, a lot of the diagnoses are not written down on these dashboards. Some of them are just total entry cases, even if there are people with a positive COVID test. Because remember, every patient that comes in now that's admitted gets a COVID-19 test in your state,
right?
From my understanding of this. And when they're tested positive, that doesn't mean they were the precipitating reason to go to hospital was that they had COVID-19. That's not true at all, in fact. It's not true. And I've looked through all of these, all the states that have this. Much of the increase in hospitalizations is due to the fact that medical care was blocked. And now there's this massive number of people that need hospitals because they have various procedures going on. So there's an increase in hospitalizations. It's not all due to the COVID-19 patients, number one. Number two, even if you're testing positive for COVID-19, that's not the reason you're hospitalized on all these patients.
Yeah, so
there's a complete distortion.
Exactly. So, we have a number, and I think it's around 2,000 total hospitalizations of COVID-19 in Texas. But like what you're pointing out is it's not as if you have 2,000 patients like from the movie Outbreak dying of this particular disease. That's not what's happening.
No, that's not.
It's
and in fact, none of these places have increasing number of deaths. And by the way, I look at California where, everyone's, oh my God, there's a spike. And then the next day the number comes down. And so there's what we call noise in the number. I mean, the data there's some vacillation in these numbers, oscillation, if you want to say. But the reality is, much of this stuff is, again, just another example of a very superficial analysis, and people take it and they run with it, and they incite fear. And this is really being done at the highest levels, by the way. It's just almost inexplicable that people are being irrational all the way, even now. Completely illogical and very superficial. There's a lot of sloppy thinking being done by some very smart people.
Yeah, I really don't get it. Now, the good news is regular people are not that dumb. I see people out all the time. People are over it.
This is absolutely true. And this is the key to getting the country back, in my own opinion. And that's why I actually go on media and talk about this stuff, because Regular people, they have common sense.
Right.
They get the logic. They just need to be explained in a very logical way what the facts are. And by the way, all this nonsense about, oh, wow, we're reopening and therefore you're seeing these spikes. Why don't they look at the states that did reopen and they never got the spike?
Yeah.
Okay, well, let's go back in the news and talk about the panic when they showed the people vacationing in Missouri with the Lake of the Ozarks. Everybody saw this on the media. They were being accused of, oh my God, these people are wild, thoughtless people. There's not been a single spike in Missouri. I looked at the data. Nothing ever happened out of that. Nothing's happening really in Florida. And they were talking about these beach goers, of 2 months ago.
Yeah.
Nothing's happening there.
And
And
it was always ridiculous because we always knew this, which is what's so frustrating. We always knew that it doesn't spread that well, and it spreads much less in an outdoor sunny environment, right? Didn't we always know that?
This was always ludicrous. And in fact, the data in the original studies in Japan and in Asia showed that the disease spreads in confined spaces, like in your home.
Yeah.
Even in New York, they had a study of all the new hospitalizations. This is a few weeks ago.
Yeah.
And they expressed shock that 2/3 of the people were already in their homes. Of course,
I saw that.
The virus has already spread.
I saw that. And a very small portion was healthcare workers. Very small portion was public transportation workers. Very small portion was first responders. Vast majority was people at home in apartments, probably because they're seeing each other, because they can't go out to the bar, they can't go out to a restaurant, but they still see each other. It's like,
honestly, it's just like, what's sad though, and really sort of frightening in a sense, is I live in California, and I saw it today already. I was outside. There are people out here, they're so afraid. People are riding their bikes with a mask on. People are playing, running on a track at Stanford with a mask on.
So stupid.
People are 100 yards away from everybody else wearing a mask outside.
Do you think they're scared, or you think they're virtue signaling?
No, well, I don't want to, I hate to impugn somebody. I'm going to give people the benefit of the doubt and say that they're afraid in California because our governor, the policies of California being locked down are completely irrational and just really a disgrace. It's an embarrassment already in my way of thinking.
It's been ridiculous
about what's being done. We have people driving in their cars alone with the mask on. And this is really a reflection of the horrible leadership at the state level here and at the county health level.
Yeah, I don't like to impugn motives either, but my sense is that people can't possibly think that they're doing anybody any good by walking alone on a sidewalk with a mask on, or even in their car with a mask on. And there is a big difference. In Texas, you generally have the opposite problem. I think you run into more situations here where you're like, maybe we should have more masks on, but we don't. It's just it's a different culture. It's a very different culture. And Houston is not some super conservative area. It's all blue. Everything here is blue. So it's not, so politics. I wrote a whole op-ed on this explaining the psychological differences between liberals and conservatives and why this, for some reason, has become has fallen along political fault lines. The reopening debate and the mask wearing debate, all of it. It's very strange at first glance why this would fall along political lines, but it does. And I think conservatives are much less likely to signal intentions and to signal virtue the way that the left would. So I don't know if they're really scared so much as they want to show support for the cause. Like it's kind of, it's very, I don't know. I'm just assuming.
I don't want to agree with you because I don't want to be accused of being political in this.
Yeah.
I think that people
have
to make their own conclusions about that, and I'm not disagreeing or agreeing with it.
It's a smart call. It's a smart call.
Well, I would say this though, and it's sort of, if I can, that there's, no matter what the rationale or the motivation of people, it to me as an American, it's very frightening to what we've learned here. Among the many things that we're learning, number one, how much control you're subjected to by your government at your state level, even. This was never anticipated, I don't think, by anyone, that just someone could, by decree, just shut you down and confine you into your home. But what's even more frightening to me personally is how many people just acquiesced to this
and called for it, and asked for it.
I'm shocked.
The complaints that I would get to say, why you have traffic laws, why can't you make people wear masks? And I said, you need to think through that. That's not, it was,
the evidence about masks, I'm happy to talk about that too. But, when I look at a place like New York, who has this opinion, there's this mode of tough New Yorkers with such common sense. These people acquiesce like crazy. And, okay, I'm empathetic to the fear, but, we're talking about 3 months of lockdown here. California is not open. I don't care what anybody says. I'm living here, and, it's not open.
It depends on where.
New York City is not open. It's really not, very minimally.
Yeah. I keep in touch with a lot of people in San Diego. I was there for 10 years. And so it depends on where in California. San Diego is run by more conservative government. So again, this falls along political fault lines, and it's unclear why. So I think you have a very different experience in the San Francisco area than you would in the San Diego area. And it's vastly different from Houston. It's the psychology of this is pretty interesting. And this is the question I wanted to ask you. Was you've been a doctor for a long time. Has our ability to confront risk as a human race, has that changed dramatically over time? I mean, what do you see?
Well, I mean, honestly, the level of medical care is astounding compared to what it was in the past. I mean, our medical care is so unbelievably good. That said, there's a lot of gaps in the knowledge that people don't understand. For instance, we don't really know even why the flu is seasonal. There are many reasons why it is. They fit a narrative that, different humidity, less travel, more sunshine, less sunshine, geographic differences, and but all these things, it's not a lot known. Our vaccines for flu, for instance, are only 40 to 60% effective. Mm-hmm. Which is another topic of this kind of mythology that once a vaccine comes, we're golden, then everybody can be relieved. I mean, it's just not that effective. So we don't know as much as general public thinks we do about medical care, but we have outstanding medical care. Much of the risk question of your question is really based on a psychology, and in ways, I think we have a culture here where everything is hyperbole, where social media is like lighting somebody on fire, and anyone who can do a Google search thinks he's an expert. So I'm turning on, I've been on, interviews, and then the person before or after me is like somebody from Shark Tank talking about hydroxychloroquine. I mean, this is just it's not okay to have, or even journalists interviewing each other as if they are experts on things like medical care or medicine, pharmaceutical agents. I mean, and there's, what the problem is, I think most of us would agree, here we're just talking about my own opinion here, but most of us would agree that objective journalism is really, I don't know if it's dead, but it's very, very impaired these days. And this has been a process that has happened, but now we're seeing it in science, which is super frightening to me, because I've been in academic medicine and in healthcare policy now all my life. And these journals that were at the top of their game, I'm talking about disgraceful publications in the New England Journal, Lancet, and now Nature. These are 3 of the top 5 journals in the world. And not only have these papers been so bad, they had to retract them, which should be an extremely rare thing. But some of them that they didn't retract are literally garbage. And they're being cited even today. Recent papers on various things that have been investigated are literally garbage. These journals should be humiliated at publishing these things. And instead, they're taken as very credible. And it's very dangerous.
It's just strange. And I'm trying to, and that's what I was asking about, was the psychology of fragility that seems to have infected our culture worldwide. But, I'm focused on American culture. So I've seen it quite a bit. You see it in politics constantly. You see it in the microaggression culture. You see it in cancel culture, which is really prevalent at the moment. But you certainly saw it during coronavirus, and
absolutely.
And that's what I mean. Like, again, you've seen patients for a long time. You've been dealing with people, and you've been at a university for a long time. you know, and you mentioned some things that might be causing it: social media, the unobjective journalism, but the loss of expertise of what you're talking about in the scientific community, that's truly devastating. What the hell is causing that? I mean, and why what is their motivation for doing this? Why they can't be that dumb, right, to publish these garbage articles that you're talking about? Can they? I don't know.
I don't know. There's an acceptance of things that support your preconceived opinion, I guess. And it's a human nature sort of question, but I never realized or never saw it before in science, because science is supposed to be, you know, you have a hypothesis, you prove it or disprove it with the data, and you're done. And instead, things are being published that are really literally garbage. I mean, it's really embarrassing. You look at these journals are now, they've disgraced themselves, as far as I'm concerned, with some of the stuff that's been published.
Yeah.
So to say why, I don't know. Maybe it's all because basically, you know, everyone's a human being. Everyone has their biases. And I feel like people are really caught up in not just the fear, but in their own sort of view of the world. And unfortunately, objectivity has been destroyed in a lot of instances.
And I have kind of a theory. I think people find purpose through crisis and purpose through fighting against something bigger than themselves, you know, and I understand that human need because I joined the SEAL teams. And a lot of the reason SEALs join, that you want to be in the most elite fighting force, you want to be in combat, you want to be in the most dangerous situations, and that's kind of weird to most people, and I understand that. But you have to understand the psychology. You know, we're basically an extreme version of most people. Most people don't want to go be SEALs and go into be combat. It's really dangerous. Sometimes you lose an eye,
right.
But we do, and we're obviously at the end of that curve. But I think humans want that to a large extent. I think it's why you're seeing, you know, we live in the most safest, most prosperous time in human history, and it causes us to lose a bit of perspective about what true suffering is and what true risk actually looks like, and it's almost like we seek it out.
Yes, but I think I think that the critical ingredient for people like you know, our leaders in government and in the policy world that make decisions that impact everybody is that we really need people who are going to look at the evidence and analyze the situation, whatever it is, and then use a reasoned sort of common sense, logical analysis of the situation. I'm sure that the people in the Navy SEALs are very good at making an assessment about. You have to use deductive reasoning. Not everything is presented to you.
You have to
this is all the process of how you make the right decisions in life, not just in medical care or in combat.
Yeah, that's right. And I would point out some simple thought experiments to debunk even what the CDC guidelines were, which didn't make sense to me. So, you know, and I'll give you an example. It said that we couldn't move to the next phase until we had a decrease in cases over 14 days. I said, okay, well, I mean, I'm not saying that's a terrible thing to look at. It's good to know, but you can't use that as your sole goalpost. I mean, and here's why. So in Houston, we have like 150 new cases a day. It's a pretty big city. That's not a lot of cases, but it's not really going down. Okay, so does that mean we can't reopen? But let's say New York has 30,000 new cases a day, but it drops to 10,000 new cases a day. You saying they can reopen? That doesn't make sense. You know, you have to look at the absolute values under these curves. And people became obsessed with the shape of the curve, obsessed with it. And the peak, it's all anybody would ever talk about. And it frustrated the hell out of me. And it's mostly local leaders across the country.
Other thing that I agree, and I would point out another really ludicrous indictment of the idea that the number of cases is a defining goalpost. And that is that decrease in number of cases, they forgot to realize, or I don't know what was the thinking there, because when you increase the number of tests, and the definition of a case is a positive test, you're going to get more cases. It has nothing to do with anything.
Right.
So, I mean, that's just really incredibly sort of strange logic there, if that's a criteria for opening.
And the testing obsession too, and that's kind of gone away over. Well, mostly because America's moved on to a different crisis, but But the obsession, right? And everybody would just scream, hey, maybe we should think about reopening. No, testing. And you're like, that's not an argument. You're just yelling the word testing. And also a test is a point in time. I mean, it's a snapshot in time. Look, the fact that a test takes a few days to get back to you, I mean, that's useful information to know that you didn't have it. Maybe you know what you did. I mean, I'm not saying it's useless information, but it kind of is because it doesn't indicate what's happened over the last couple of days. And it's a snapshot.
There's really only a couple of populations where we absolutely need testing. One is the people who enter nursing homes.
Yeah.
We can't have people who are infected go in and kill everybody who's in there because
and they
they're
should
so
be
vulnerable.
but regular testing too. I mean,
regular testing, but it doesn't have to be every day, but it has to be a reasonable period of testing. And the other population, of course, healthcare workers that are dealing with patients. We can't have the disease spreading inside hospitals, and people who come in who are hospitalized need to be tested because they too would be a source of spread. But this idea of something called contact tracing, where you test somebody and they determine who they've interacted with, that's not an appropriate tool once a pandemic is already established.
Yeah, it's overwhelming. That's
when you're at the very, very beginning, when there's a small thing going on in a church, like in South Korea, or somewhere in a very new source of infection. But once you have millions of people that are already infected, there's zero reason to have contact tracing.
Yeah.
And it's just simply illogical.
It's an overwhelming project.
Contact tracing when you have thousands of people protesting on the street. Where's the idea now calling for contact tracing? You don't hear it, of course, because it's ludicrous. Somebody gets on a subway in Manhattan and they are on two different trains and this guy had the disease. How do you do contact tracing when they've encountered thousands of people that day? And then each one of those has to be investigated. I mean, the whole thing is irrational once the pandemic's established. That was never a rational public policy.
It was also irrational it seemed like the entire country kept using New York as, this is what we should be in for, just like New York. Now, and there's a question for you. I mean, it seems like New York, based on their numbers and their near overwhelming of their hospital capacity, they had a better reason, at least, for locking down for a period of time. Would you agree with that?
Well, I mean, New York is of course very different. Yes, I mean they were the only place really that had a couple of places where they were overwhelmed with their medical system. Now it's going to come out, and it already is starting to come out, that a lot of that spread in New York was inside the hospitals themselves. Okay, that's another huge error. But New York was a setup for this because, there's so many tourists that come into the U.S. The number one port of entry from China tourists is JFK Airport. There's exactly 1.6 million commuters that go in and out of Manhattan every single day, and more than half of them are on a cramped train. So there's this different sort of lifestyle in New York City, in the commuting crowds, small spaces. And of course, that affected the whole New York, New Jersey, Connecticut tri-state area, because there's something like 320,000 commuters from New Jersey alone every single day into New York City.
It should have been obvious.
That part of the country, had it bad. They had their own reasons why it was bad. But when the people there said we need 30,000 ventilators immediately, and that's what's going to happen to the rest of the country, that was just inexcusable panic and language. They only used 5,000 plus ventilators, by the way.
Yeah.
The country did learn how to mobilize resources, and this is something that people should feel very good about, is that if there is a second wave, and there's no one that knows there's any second wave, no one. In fact, other coronaviruses didn't necessarily have a second wave. But if there is a second wave, or if there is another pandemic, which is almost certain to happen at some point in time, then we have learned quite a bit here, not just about social distancing and this sort of thing, but we've learned how to mobilize resources, and we're learning more now. And I and others are working with the government on figuring out and how to be more prepared, how to have more stockpiles, but also how to be able to mobilize and use resources more efficiently.
Yeah, and this is what it made me so frustrated to hear from our local leaders here, county judges especially. They would constantly say, this is happening in New York. It's just a matter of time before it happens in Houston. And I'm like, no, it's not. We don't even have a subway system in Houston. Okay, we don't do any public transportation. Totally different lifestyle. It's also hotter here. That matters. We don't have the international travel. There's not Chinese tourists lining our streets the way that there is in New York. It should have been obvious to everybody from the beginning. And, it seems like California was largely spared because of the travel ban on January 31st. Somebody was telling me just recently, there's, I think, like 28 flights from Wuhan to California daily, direct, I think. I mean, it was a huge number that was stopped. Huge number.
And it's really not even clear, honestly, back to your first question about the impact of the lockdowns. In the beginning, people said, oh, the lockdowns in California did X, Y, and Z. It's not clear. Really. It's not clear at all they had any impact. And in fact, there's evidence that the infections were already here. And it goes to very complicated topics like how could you be immune? How many people really are immune, even though they don't have these specific antibodies, which is sort of maybe too boring and too detailed to talk about. But the reality is it's not the masks that were the reason why Asian cultures in Asia didn't get more infections. They had previous immunity. There's more and more data coming out from other coronaviruses that are related. There's all kinds of reasons why they had lower infections. And to have people jump to some kind of conclusion about masks, when even the WHO today still says there is not sound scientific evidence for masks, and therefore we do not recommend, the WHO does not recommend widespread population masks to control the infection, except under certain circumstances.
Yeah, I mean, I guess
so
if
that whole evidence stuff has really been exaggerated and out of control. Again, another irrational use of sort of superficial analysis of policy.
Yeah, and that kind of answers my question, because I was going to ask, why didn't South Korea really get hit hard? They're a very, very, Seoul is probably more crowded, I think, than New York City is.
Sure.
I've spent a lot of time there.
Well, there's several reasons. I mean, there's no clear absolute reason, but one reason is they did get it very early. They had an outbreak in a religious setting, and they stopped that outbreak. Also, they had previous, it's highly likely that those countries in Asia had previous immunity. And, they were experienced with other SARS, with the previous SARS and with other coronavirus issues. So they were sort of a different level. It's a different country. It's a different, it's a different set of people living there with a different level of immunity. There's a lot of reasons. But, to think that it's just sort of like hard to compare the U.S. as a whole when every region is very different. I mean, California, Texas, Iowa and New York are very different areas. And so the sort of statistical analysis, it doesn't quite hold. There's so many factors, but people are so sort of interested in pinning their favorite reason on something. And in this day and age, one of the favorite reasons is a mask is a panacea.
Yeah, and it's like seems like a mask is only good if you're a spit talker. And you want to prevent that. I mean, that seems like the only good reason. And, makes people feel good on an airplane, fine.
Well, I mean, I think that, it's fine to have a mask for a reason. And those reasons are people taking care of sick COVID patients, not asymptomatic, sick COVID patients. In other words, if you think that someone's going to cough in your face, it's a good idea to wear a mask. Mm-hmm. If you personally are afraid and you feel it's a problem, then you can wear a mask. But no one should be forced to wear a mask because there's no problem with healthy people getting the infection. That's point number one. Point number two is if you don't want to go into a crowded place without a mask, then wear a mask. If you don't want to go into a restaurant for the rest of your life, then don't go in the restaurant. Right? If you don't want to go onto a subway, then don't go in the subway.
Yeah,
that doesn't mean that we lock everybody down and impose bizarre, irrational requirements on them.
Yeah, and I've done a lot of podcasts on it's more of a civics discussion at that point about what is the ability of government to actually force behavior, and I think we've vastly overstepped on that. But what about asymptomatic spread? And so because this has been up for debate now, and there's some indications that the asymptomatic spread that we were worried about was never really true. And so what is your read on that?
Okay, so, yeah, well, here's it's an example of when somebody speaks the truth. If it's against what this sort of conventional fear narrative is, they get hammered. And that's what happened to the scientist from WHO the other day, who said it's rare to have asymptomatic people spread the disease. And of course, Fauci's all over the media, and everybody is saying that's completely wrong. First of all, no one ever said that you cannot have spread from an asymptomatic person, and she didn't say that, and it's true. No one should say it's impossible to have spread from an asymptomatic person. But when you look at the actual studies, here's what we know: the overwhelming majority of cases are spread from symptomatic people. Okay, we know that because we know that the overwhelming majority of cases are spread by a small number of people. And these people have been called super spreaders, and these people are symptomatic people. They're not asymptomatic. We know from the studies of Singapore in contact tracing, in one study, 6% of infections were from asymptomatic people. We know that the people with symptoms have a higher amount of virus in them. The viral load, or the burden of disease, is higher. And we know that the spread is more when there's a higher viral load. So we know that happens. We know that children have very low viral loads, and we know children rarely, if ever, spread the disease. And we know that people that are asymptomatic, if they're going to get symptoms, they get a higher viral load when they become symptomatic, right at the time when they become symptomatic, roughly. So all the data implies that pure asymptomatic people, not people who are going to be symptomatic, but pure asymptomatic people, it's unusual for them to spread the disease. I mean, I know that drives people crazy because it goes against their notion that we must have everyone wear a mask for the rest of their lives, but it's just not the science.
Yeah, and that's really good to know, and it's not getting out there enough. It's some. I think Twitter it tried to remove certain posts that would claim such things. It's like this is backed up by studies, and we have to talk about the actual fact. The other reason I often say that I think it's clear in hindsight that lockdowns never did what we said they were going to do is the simple fact that when we stopped locking down, the spread of the virus didn't change all that much. If at all. I mean, that simple fact alone should demonstrate that we can't do this again. We really can't do this again. The cost benefit just isn't there.
And, by the way, we can be apolitical and look outside the United States. And we know that the countries who have opened up, and I'm talking about Switzerland, Austria, Denmark, Spain, Italy, Sweden, all these countries that opened are not experiencing these pre-opening projections of massive cases and hospitalizations and deaths. In fact, they're all accelerating their opening. So we can take it away from the world of state governments that are controlled by Democrats or Republicans and just look at the countries who are opening before the United States did, and we see that they're doing fine. They're doing well. It's not an issue. It's true we want to make sure that the people who are sick self-isolate, because these are the people who are going to spread this disease. And so if you're sick, if you feel you have these symptoms, flu-ish symptoms and other symptoms, you have to be responsible and self-isolate. And we have to protect the very old, vulnerable people, particularly the nursing home residents. But other than that, I think that's bizarre. It's sad and completely wrong to stop schools from opening. It's ridiculous to have children in schools required to be 6 feet apart and to wear masks. It's completely wrong and against the science. There's zero reason for that. And businesses and other offices can open with good standards of hygiene and with, really warning about, if you're in these categories, if you're a 75-year-old obese diabetic, you're at high risk here. If you want to come in, you can come in, though. I mean, I don't know what kind of country it would be to say to somebody we're going to protect you, therefore you're confined to the house for the rest of your life. Yeah, I'm not sure what the rationale for that is.
It's the strangest thing, and it seems obvious to me that we're really just delaying the inevitable. Again, you have a virus with no cure and no vaccine. So you can keep locking down and watch the spread continue to occur and hope that one day there's no cases, which is a crazy hope to have. but you're really just setting yourself up for a sharper spike in a second wave, whereas it's much more manageable to engage in what I would call micro interaction, smart micro interactions, and people are perfectly capable of doing that. People understand the risk at this point, and they're willing to take it if you just let them. And this strange notion that if you feel unsafe, then you should prevent other people from going to restaurants and opening their retail shops is so utterly ludicrous.
It's ludicrous, but it's also, we keep forgetting, again, the destruction from the lockdown. It's not just we better stay safe until a vaccine comes. You're killing people with the lockdown. You're destroying people's lives. I didn't mention some of the other things. I'll give you another really sick statistic here. I got an email from people in children's hospitals in Michigan, from the pediatric emergency room doctors, who said that the rate of serious child abuse is up 35% in the ER. And what that means, you have to realize who comes into the hospital who's abusing their child. They're afraid they killed the kid.
Jeez.
And so we're jumping a 35% jump in that because of the lockdown. Because these people are the child abuse correlates to unemployment, low socioeconomic groups, and drug abuse and alcohol abuse, all of which have gotten worse because of the lockdown. 40% of people who make under $40,000 a year lost their jobs. That's who got killed by the lockdown. And so these people, now there's a 35% increase in serious child abuse, and the rest of the child abuse we're not even seeing. And you know why? Because the number one place that child abuse is detected is by the teachers in the schools.
Yeah. And
you close the schools. So there's this tragic tragedy going on here, and it really is. If you think about it, it's so harmful, the lockdown, and I just, for some reason, no one cares. The policy itself is much worse than the infection from COVID-19.
Yeah, and I think that's the message, and I don't see how you can listen to this. We're going on an hour now of conversation, and ever want to do this again. I mean, it was just, and that's been my point. I don't even want to point fingers, we can, and I do sometimes, but I just want to make sure we don't do this again, because there will be more infections. There might be other spikes. I don't know, but I just know we can't do this again. It was not rational. We were better prepared for it. We can't do this again. I mean, we just can't. I mean, the costs are too high. I
agree completely.
Well, you got anything else you want to add, or do you want to end it there? I think we made our point.
I think we made our points. I mean, I encourage people, when you don't understand what's going on, because there's all kinds of mixed messages, use common sense here. I think Americans understand, in general, what makes sense and what doesn't. And when you hear people talk about a sort of frantic reaction to every single bit of news, I think that's just simply not the way to live. And so I think when you have common sense, you're going to be able to digest the information. And frankly, in many of the states, it's going to be up to the people to just say enough is enough.
And they have. And
they're starting to.
Yeah. Well, that's all we can hope for, because I think the American spirit is one of understanding risk and understanding how to live with freedom, and that takes with it a certain amount of responsibility. And we've really got to get that back in our culture.